The Transforming Cancer Services team has been funded by Macmillan for the last 4 years on programmes for cancer rehabilitation and lymphedema, and the last 3 years for psychosocial support in cancer. The team has also worked really closely with South West London Health and Care Partnership on their Macmillan funded programme for primary care nursing and cancer. All this funding is coming to an end in March 2020, so we held a Next Steps event on the 12th of February to talk about what we've done, but more importantly to help the London systems to think about what they do next with this work.
Today's event is really important because this is about the how things can move forward to improve psychosocial support for adults affected by cancer in London. We've done a lot of work within the Transforming Cancer Services team. We've produced a lot of documents which should help people, but we really want people in London now to think how they can take forward the next steps to really improve psychosocial support.
So in South West London SDP, we have agreed cancer psychosocial services to be a priority across the SDP, recognising the need for parity of listening between mental and physical health.
I hope at the end of today's event people will feel not just connected to that work but have a much deeper understanding of what the work has delivered so far, but they'll be able to take the tools and the resources that have been provided and use those to make sure that we can plug the gaps in services, that we can make sure that we take action that really improves services for people living with cancer.
We've got really comprehensive guidance now, both for lymphedema and for cancer rehabilitation. Our lymphedema guidance is going to be refreshed and available at the end of March. And we've got resources within there that can be used and embedded. It's good to go. So things like our cancer rehabilitation service improvement tools. Services that are delivering rehab at the moment can just pick these up and use them to look at what they're providing and to try and make areas or identify areas where they're doing great work, but also maybe areas where they need to think about doing some development.
I'd just like to hark back to what Karen was saying earlier about the service improvement tools and to show how marvellous they've been. We've used them both in speech and language therapy and physiotherapy to benchmark our services. We've used them in a specific area of head and neck and speech therapy, and they've enabled us to evaluate where we are.
Service users have been given a strong voice, so in previous events we've met before so that we could put forward our feelings and then they could be incorporated when we faced all of you.
My real conviction is that we use it as the starting point to develop something really system-wide.
There are a really great opportunity to hand over the baton to the system leaders and people who are out there delivering this work day to day to take responsibility and move this work forward.
So there's lots of work to be done, but I think we've made a good start on a lot of it.
I think the future looks good. So by this time next year, I anticipate that we'll have roles similar to mine in each of the STPs, which, considering where we were 2 years ago, is a big move forward. As a result of that, we'll have work going on with primary care nurses in each part of London. That's going to have a benefit for patients, a real tangible benefit for patients.